Vitamin B6, also known as pyridoxine, is a crucial nutrient that our bodies need to function properly. It is involved in more than 100 enzyme reactions in your body. These reactions help you with many things like metabolism, brain development, and immune function. So the deficiency of vitamin B6 may have devastating effects on your body. But how can you tell if you have a vitamin B6 deficiency? Today, I'll tell you about the 10 signs of vitamin B6 deficiency people always ignore, and how to address them for overall better health and well-being. Number 1. Tingling in hands and feet. Many people ignore this sign by thinking that it usually happens when we stick to our position for too long. But do you know that this tingling feeling can be a sign of vitamin B6 deficiency? And this deficiency can make your symptoms worse. Vitamin B6 is involved in the formation and maintenance of myelin, the protective sheath that surrounds nerve fibers, and protects them from oxidative stress and free radical damage. But if myelin gets damaged, it can mess with nerve signals, including the ones that communicate touch signals, causing sensations of numbness and tingling. And if it gets worse, it can lead to peripheral neuropathy, a condition in which you may start feeling pains, muscle weakness, and difficulty moving. Taking enough vitamin B6 helps ensure that your nerves communicate signals properly. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Sound sensitivity. First off, sound sensitivity is when you become more sensitive to sounds than usual. Imagine if a normal conversation or a regular TV volume feels like a rock concert. That's what sound sensitivity can be like. This can be pretty uncomfortable and sometimes even painful for people. Now let's get into why a deficiency in vitamin B6 can lead to this. One of the functions of vitamin B6 is to help our nerves convey sound signals to the brain so that the brain can identify them. Without enough vitamin B6, this communication can get disturbed, leading to sound sensitivity. So if you are often feeling that too, you should consult with a doctor and get your vitamin B6 levels checked. Number 3. Constant fatigue. Constant fatigue is like feeling worn out and lacking energy all the time, no matter how much you rest. One possible reason for this is a deficiency in vitamin B6. This vitamin plays a vital role in converting the food you eat into the energy your body needs to function. But when you don't have enough vitamin B6, your cells may not produce as much energy as they should, leading to feelings of tiredness. Additionally, vitamin B6 is also involved in making important chemicals in your brain that regulate mood, like GABA, serotonin, and dopamine. So, a shortage of this vitamin can not just make you tired, but can make you feel stressed too. So if you are feeling unusually tired, anxious, stressed, or aggressive, this could be due to vitamin B6 deficiency. Number 4. Convulsions and seizures. Convulsions and seizures are basically sudden, uncontrolled electrical disturbances in the brain that can lead to abnormal movements, loss of consciousness, and other symptoms. And surprisingly, a critical vitamin B6 deficiency may also cause these symptoms. Again, this is related to the health of your nerves and the production of neurotransmitters, as I said before. It can cause feelings of confusion, lack of focus, and in worst cases, seizures too. Number 5. Coordination and balance. Muscle coordination allows us to control our muscles and perform tasks like walking, writing, or catching a ball, while balance helps us stay upright and stable. Now, when it comes to vitamin B6, it plays a vital role in maintaining these functions. Without enough vitamin B6, your nervous system may struggle to communicate effectively with your muscles. This can lead to unsteady movements, shaky hands, or difficulty walking in a straight line. So to maintain good coordination and balance, it's essential to make sure you're getting enough vitamin B6 through a balanced diet, or supplements if recommended by a healthcare professional. Number 6. Blood clotting. Blood clotting or coagulation is a vital process that helps prevent excessive bleeding when we get injured. You can consider it a natural repair or healing system in your body. Now, here's where vitamin B6 comes into play. It assists in making specific proteins, particularly fibrinogen, that binds the red blood cells together and form a plug, which then seals the wound and prevents bleeding. Without enough vitamin B6, the production of fibrinogen can be affected. Moreover, vitamin B6 also helps to bring down homocysteine levels. Homocysteine is basically an amino acid whose high levels indicate inflammation in the blood vessels and a high risk of developing plaque or blood clots in the arteries. Luckily, vitamin B6 also helps to prevent excessive clotting by bringing down homocysteine levels. And it does that without the blood-thinning effects that many typical medications offer. Anyhow, if you have noticed that your wounds are taking too long to heal, then you must consider the possibility of having B6 deficiency. Plus, if you are already diabetic or a heart patient, you must talk to your health expert before taking B6 supplements. Number 7. High blood sugar levels. Vitamin B6 helps in the metabolism of glucose, which means it helps break down the sugars we get from food into a form that our cells can use for energy. When you're deficient in vitamin B6, this process can be disturbed. As a result, your blood sugar levels might become unstable. If your blood sugar levels are consistently too high, it can lead to a condition called hyperglycemia. This can cause symptoms like increased thirst, frequent urination, and fatigue. On the other hand, if your blood sugar levels drop too low, you might experience symptoms of hypoglycemia, like shakiness, dizziness, and confusion. So having enough vitamin B6 is important for maintaining stable blood sugar levels. It helps ensure that the glucose from your food gets used effectively, providing you with the energy you need to go about your day. Number 8. Certain mental conditions. Vitamin B6 is essential for converting amino acids, the building blocks of proteins, into useful forms. These proteins are involved in the structure and function of our brain cells. Without enough B6, our brain cells may not work as efficiently, leading to cognitive issues like memory problems and difficulty concentrating. So ensuring a proper intake of vitamin B6 through a well-balanced diet or supplements if needed can help support your mental well-being. Number 9. Glossitis and stomatitis. Both glossitis and stomatitis are mouth-related conditions that can be connected to a deficiency in vitamin B6. Glossitis refers to the inflammation or swelling of the tongue, often causing discomfort and difficulty with eating and speaking. Stomatitis, on the other hand, is a broader term that includes inflammation in the entire mouth, including the gums, lips, cheeks, and tongue. Vitamin B6 plays a major role in maintaining the health of the mouth's tissues and nerves. Without enough vitamin B6, the tongue and other oral tissues may become more open to inflammation and irritation. So if you notice these signs and suspect a vitamin B6 deficiency, it's essential to consult a healthcare professional for proper diagnosis and treatment. Number 10. Trouble sleeping. Difficulty sleeping, also known as insomnia, can be a frustrating issue that many of us face from time to time. Vitamin B6 plays a major role in sleep regulation, and a deficiency in this essential nutrient can contribute to sleep problems. Vitamin B6 is involved in the production of neurotransmitters, particularly serotonin, melatonin, and GABA. Melatonin helps regulate our sleep-wake cycles. Serotonin helps regulate our mood and has a calming effect. And GABA acts like an off switch to stress and helps keep it down. So when B6 is low in your body, there might be fewer of these hormones available, making it harder for you to relax and fall asleep. And taking enough vitamin B6 can help avoid all these issues that I've told you about in this video. Most healthy adults aged between 19 to 50 years need almost 1.3 milligrams of vitamin B6 every day. Older individuals need slightly more than that, around 1.5 to 1.7 milligrams per day. Pregnant women need about 1.9 milligrams, and breastfeeding women need about 2 milligrams of vitamin B6 per day. Some of the richest foods in vitamin B6 are grass-fed and lean varieties of chicken, turkey, and beef. You can also get enough of this vitamin from fish like salmon, tuna, and trout, in addition to whole grains, legumes, nuts, and seeds. Alternatively, you can also consider taking vitamin B6 supplements as per the advice of your healthcare expert. But do remember to follow the vitamin B6 dosage as recommended by your doctor. Taking enough vitamin B6 can be helpful, but taking too much of it can be disastrous. Plus, if you have chronic kidney disease, if you are a pregnant or breastfeeding woman, if you are expecting surgery, or if you are taking medications for diabetes, heart disease, and neurological conditions like epilepsy or Parkinson's disease, then you must be especially careful about B6 dosage. Thank you for watching and subscribing to the channel. See you in the next video.